may have noticed all the changes that are taking place at your hospital. A brand new community diagnostics centre opened in the summer, boasting state-of-the-art scanning equipment. And our orthopaedic elective hub will be receiving its first patients later this year, helping us reduce our waiting list for operations such as knee and hip replacements. But we're not just building a healthier future for our patients and staff with bricks and mortar. We're really embracing digital technology, and here's how.
If you think of a normal hospital ward, it's normally about 30 patients, 35 patients in a hospital bed, normally in an open bay with other people. And that's been the norm for decades. That's what people know a hospital is. So these days, due to advancements in technology, we can support patients from home using what we call our virtual ward. They receive inpatient care in the setting of their own home, helping reduce pressure on the hospital's bed capacity. The virtual ward staff talks to patients daily and has conversations on their clinical observations, such as temperature, blood pressure and oxygen levels, provided remotely by medical devices. Information from these conversations is then discussed by a multidisciplinary team during the morning ward round, led by consultants who decide on the next steps in each patient's care, just as they would on an actual ward in the hospital. Patients whose data shows indications of deterioration can be brought into hospital for further observations, while those who no longer need hospital care can be discharged as they would from a regular ward. The number of patients receiving care on our virtual ward has steadily increased over the 4 years it's been in operation. Originally set up for patients recovering from COVID, the ward now provides care for people with conditions ranging from chronic obstructive pulmonary disease, asthma, diabetes and heart failure. The virtual ward gives us a glimpse into the future. As the technology advances, we anticipate more and more patients with more and more conditions can be managed at home.
For many people, day-to-day life is now conducted on their mobile phone, whether this is ordering your groceries, booking a train ticket or even ordering a pizza. And now it's the same for your healthcare. The NHS app enables patients to order repeat prescriptions, securely view their GP health records, view test results and get health advice via 111 online. In tandem with this, the James Paget Hospital has developed a patient engagement portal to keep in touch with patients in real time via their mobile devices. The patient engagement portal gives patients the option to view their hospital appointment letters digitally, so they don't have to wait for the paper version to arrive via the post. Looking ahead, via the patient engagement portal, patients will soon be able to view their outpatient appointment letter via the NHS app, which is continually being updated to help support our patients to enable them to access the healthcare they need via their device in their pocket.
So the shared care record has been a real game changer for our staff here at the James Paget. It's an initiative from the ICB which has included 10 organisations at present sharing their records across the system. It's really made it much easier for staff to access information from social care, mental health organisations, other trusts, anyone providing care for that patient. We know from surveys that we did that some teams had to access up to 14 different systems previously, so it has really saved them time.
So I really like the shared care record. I use it on a regular basis. It's really important for me to be able to keep a track of my patients. I like to be able to know when my patients are being seen by different clinicians, and I like to know what decisions they've made about them. Some of my patients are looked after both here at the James Paget, but also at the Norfolk and Norwich as well. Being able to find out what decisions have been made over at the Norfolk and Norwich keeps me in the picture as to how they're getting on with their treatment, and when I see them next, I'm fully aware of how things have been going and what the next plans are. I also find it really useful when I'm seeing patients for the first time and they're coming in from primary care. The shared care record gives me full access to the GP notes and also the prescriptions that they are regularly taking, any allergies and things like that. When a patient comes into the hospital setting, they've got a lot on their mind, and being able to recall 100% of their history is nigh on impossible. I think patients are often surprised if they have to tell the same story over and over again to clinicians, and it just makes sense for us to be able to know that without hearing it from them.
The electronic patient record, referred to as the EPR, is the biggest transformation initiative that the 3 acute hospitals across Norfolk have embarked on ever. It is a transformation programme which is enabled by digital, because we'll be changing workflows, we'll be changing how our clinical and operational staff work across the 3 hospitals. It will replace the paper clipboard record at the base of the patient's bed with a digital record. The EPR is a transformation programme that is being nationally led. So all of our NHS providers are looking to digitise patient information. Locally in Norfolk and Waveney, we're looking to have the EPR live in 2026. We're on the EPR journey. The latest step, having signed the contract with Meditech, the supplier, is having embarked on the implementation phase. We're recruiting all of the additional staff that will be supporting us from our 3 hospitals to ensure that we are ready for go live in 2026.
So the EPR will help our staff provide high quality, safe care to our patients with information available when it is needed, where it is needed, irrespective of where the patient is seen at one of our 3 acute hospitals. For our staff, the availability of safe, secure information in an accessible manner will help enable them to provide really good quality, safe care. For our patients, it will improve their experience of our services, not having to repeat their story multiple times to multiple healthcare providers, having to remember the health information and go over things again and again.
So lots of exciting developments in the digital world here at the James Paget Hospital. To keep up to date with these and other developments and initiatives taking place at our hospital, follow us on Facebook, Instagram and LinkedIn, and visit our website at www.jpaget.nhs.uk.